Hi, welcome everyone. In this short video session, I am going to discuss with you about the new or evolving, or you can even tell as an already established concept of thin fat Indians. Thin fat Indians means they have normal BMI, but these Indians are metabolically obese. Metabolically obese means even though these patients have normal range of BMI, they can have diabetes, hypertension, high cholesterol, fatty liver, high uric acid, and all other features of metabolic syndromes like acanthosis nigricans, polycystic ovarian disease, etc. So we will discuss more about this concept. Generally, Indians have a lower rate of obesity when compared with Western counterparts. But the prevalence of various metabolic abnormalities like diabetes, dyslipidemia, hypertension, fatty liver, etc. is same or even more than when compared with the Western countries. What could be the reason? It is because of this we tell that Indians are prone to be metabolically obese even with a normal weight. This is a classical caricature figure of a thin fat Indian. Here, this Indian have thin and short extremities, lower skeletal muscle mass, but is having a high central obesity with higher waist circumference, higher visceral fat. So when the central obesity is there will be corresponding visceral fat inside the abdomen, and this leads to higher rates of insulin resistance and various metabolic components of various metabolic syndrome. Why? What is the reason why Indians are prone to be metabolically obese even with normal BMI? Adipose tissue overflow theory can explain the reasons. Indians have less superficial subcutaneous adipose tissue. Normally, this is genetically or mediated. Our build is like that. We do not have in a good volume of superficial or external subcutaneous adipose tissue. What will happen if Indians overeat, but he or she do not have adequate physical activity? So all this energy or calories which is taken during overeating or taken by overeating will get converted to fat, and these fat need to be deposited in the adipose tissue. But Indians do not have enough superficial subcutaneous tissue. These superficial subcutaneous tissues are metabolically inert. They won't cause much issue. Since this store of superficial adipose tissue is less, these converted fat will be channeled to the visceral area, and it results in visceral obesity. So externally, or if we calculate the BMI, patient will not come in the obesity or overweight range, but he or she can have visceral obesity or increased visceral fat accumulation, and this is the visceral fat which is the notorious fat which causes the metabolic syndrome. So the superficial fat is less, so the excess energy we consume is converted to fat, and this fat is channeled inside the visceral to the visceral area. So that this could explain the reason for metabolically obese Indians with normal BMI. Due to this, there is a compelling need to redefine the BMI cutoff for Indians. World Health Organization in 2004 has redefined the obesity and overweight cutoff for South Asians. Our international cutoff is if BMI is more than 30, an individual is said to be obese, and if BMI is between 25 to 30, he or she is having overweight. But in 2004, because of this reason, WHO has redefined the obesity cutoff for South Asians, with obesity defined as more than 27.5 kilogram per meter square and overweight as defined as 23 to 27.4. But specifically for Indians, even this lower cutoff is not sensitive enough to screen patients who are having metabolic syndrome. So due to this, Prevention and Management of Obesity and Metabolic Syndrome Group in 2008 again redefined the cutoff, and for Indians the cutoff is obesity means BMI more than 25 kilogram per meter square and overweight means BMI between 23 to 25. So ideally Indians should have a BMI less than 23. The international cutoff of 25 cannot be extrapolated to our population. Even with this BMI, lower BMI cutoff of 23 kilogram per meter square, still it is not that sensitive. Even patients having BMI less than 23 can have various components of metabolic syndrome. So we need a better screening tool. Waist-hip ratio can act as a better screening tool in different occasions. Waist-hip ratio is a measure of central obesity. Here we will take the circumference at the waist and at the hip and we will take the ratio. There are two types of obesity. If the obesity is above the waist, it is called apple type of obesity. Here the waist will be more, hip will be less, waist-hip ratio will be more. Here we will have a patient is said to have central obesity, and this central obesity means there will be correlatingly equal proportion of fat inside the abdomen, or visceral fat will be also proportionately high if waist-hip ratio is high. So central obesity can be quantitatively expressed as waist-hip ratio, and this gives a measure of visceral adiposity or visceral fat mass. Second type of obesity is called pear-shaped obesity. It is classically more in female, where the fat deposition is below the waist at the hip region. Here waist is small, hip is large, so waist-hip ratio is small. Ideally for females, waist-hip ratio should be less than 0.7, and for males it should be less than 0.8. Higher the waist-hip ratio, more is the central obesity, and proportionately more will be the visceral obesity, and thus there is a higher risk for metabolic syndrome. So that's all. So take home message for this short video session is, I need to stress 4 points. First point number 1, Indians are prone to become metabolically obese with normal BMI. Having a normal BMI does not mean that an individual is metabolically fit. Everyone, all practicing doctors in our region has to familiarize with the concept of thin fat Indian phenotype, and we have to recognize this phenotype and do the necessary corrective measures in the form of diet and lifestyle intervention. Thirdly, third point, BMI cutoff for Indians need to be different. The international cutoff should not be extrapolated to our population. Ideally, the cutoff should be lower, and we can take the cutoff of BMI for obesity as 25 and overweight as 23. Waist hip ratio, which is a measure of central obesity, is equally or more important than BMI among Indians. Thank you for watching.